welcome to the subcutaneous skills video. Everything you want to know about subcutaneous injections and maybe more. First, we're going to start off with where to give the subcutaneous injections. So I have this handy dandy chart here that gives you a nice picture of behind the arms, the abdomen, the outer part of the thighs here, and making sure it's the fatty part, and even back behind above here, the love handles they've called. These are tough positions to get to the patient, so I would say 90% of the time I'm usually up in here with the insulin with the arms, and then of course all of your anticoagulants like your heparin are given in your abdomen. And we want to avoid the abdomen area. We want to go 2 inches around here, and we're going to go into the 4 quadrants with that. We'll talk a little bit about that a little bit later. Next, we're going to talk about syringe and needle selection. This seems to be a really hot topic that students have a hard time with. So I have my chart here, and the first thing you want to consider is how much you're going to be giving your patient. So if it's anything a milliliter or less, they do have a syringe that looks like this that can be used, but you'll notice the top's a little different. These do fit on here. You can use this for the 1 milliliter. Now the Luer lock, or the screw ones on here, are 3 milliliters. And so this might be a nice selection if you're doing, half a milliliter of heparin or something like that. Your insulin syringes, I just wanted to point these out quickly too. There's 2 different sizes with those. There's a 50 unit, and then that's a half a milliliter. And then there's a 100 unit, which is 1 milliliter. So just be aware of that when you go and grab them. And if you look on the packaging, they all say U100 on them. That's not the amount of units that's in there. It's the type of insulin you're going to be using. And if you look on your bottles, it will say U100 as the medicine. So just be aware of that too. I think there's some other like U500 coming out. Might be a little bit different needle that you're going to be using. These are already attached, so you don't have to select your needle, which makes it nice. But if you're going to go for, you need to select a needle for like heparin, you're going to be giving sub-Q. A 5/8 needle is nice, and we like to say they're in the 8s. So we like to go from anywhere from 3/8, which is a small, to 5/8. And the 4/8 is the ½ inch. So anywhere from 3/8 to 5/8 is your needle selection for giving injections. Also, when you're getting your equipment together, if you're going to need to assemble a needle on, you want to get something to pull the medicine up. So I've given you 2 different options here that you'll see at the hospital. Best practice is saying that to use a filter needle is best in that it helps with the coring. So that filter in there will keep this coring from pulling up into the syringe and then getting into your medicine and then getting to your patient. If you don't have the filter needle to use, you'll see a lot of nurses using this 18 gauge or 1½ inch needle, and that's fine too. Best practice is saying if you're using this needle, if you go at an angle with that bevel, that will help prevent coring too. And we'll talk a little bit about that later when we start pulling these up. But I just wanted to show you just some of the things to pick from when you're doing a sub-Q. A lot of your sub-Qs too will come pre-packaged, like your Lovenox. Trying to think what other, that's probably the only ones I can think of right now. But they'll come with the needle attached to this, so you don't have to select. But if not, go through 5/8 needle, select your syringe, and then get a needle to pull up the medicine with. And we'll go over that in a little bit. But let's just talk about gauge for a minute. So I have over here looking at the gauges and needle sizes. Sometimes students kind of get a little caught up in this too. But you need to remember, like, the bigger the number, the smaller the smaller the hole is going to be. So the 29 is smaller than the 25, which is going to be a larger hole. So you can even see it very clearly how this 18 gauge, which is a really thick opening gauge, is much leaner or tinier than your 5/8 needle, which is a tiny 25 gauge. So just keep this in mind. Your 5/8 needle that you're usually picking for your heparin is a 25 gauge. It's a little bit smaller, but you need to take in consideration the medicine that you're pulling up. If it's a really thick medicine, you can go with a bigger gauge. That would be helpful. And that's all I need to say about gauges. So let's move on to picking out and assembling this together. So that's kind of the fun part. So once I have my needle selection, we'll do insulin first, since that's one that you guys be doing a lot of. You do not need to wear gloves during this time when you're drawing up insulin or drawing up medicine. I don't have my, oh, here we go, I have an MPH. So one thing you remember about MPH is it is cloudy, so we want to roll it to mix it up. We don't shake it, all right? And you're checking your expiration date. Putting your thing down here, and you're gonna scrub this for 15 seconds, and you're gonna allow that to dry. So while that's drying, I can get my syringe out. So 14, 15 seconds of scrubbing the top, and then you're gonna get your needle out. These are nice. This will come attached like this and lay flat on the table. Some of the newer ones coming out at LG are rounded, and you don't have that option, but we do now. So you're looking at your order, and then you want to pull back whatever you needed. Let's say it was 10 units that I was going to pull up for my patient. So I'm going to pull back to 10. I'm going to hold my vial. I'm going to put air to air. So I'm pushing this in, and I'm going straight in. And notice my finger wasn't here when I went in to push that. So let's try that again. I didn't do this. My finger's out of the way. It's more like a dart. So then you go straight in, air to air, and then turn your bottle. When you turn it, you'll be able to see an opening. Every vial you ever handle will have this opening here that you can see where your needle is. Now this is cloudy, I really can't see the needle, but that will come in handy later when we do IM injections. So then I pull back very quickly, and I'll pull back just a little extra, and then I'll push it back up to get the air out. The slower you go, you tend to get more air bubbles in there. And then I hold my vial, and then you can flick it a little bit if you need to get to bubbles. Move this around. If it's a lot of air, I'm just going to push it all back in and pull it out again quickly, and then pass the point a little bit and then push it back up. Now if you're mixing insulins, which you can check your book out for that, you can't go back and forth like that. So you have to be careful with measurement. But if it's just regular MPH that you're pulling up, you can pull back a little extra and go to your mark that you need. So I have this at 10 units, so I'm going to be pulling this out, and then I'm going to recap it with one hand. We don't ever want to be doing this. And I want to show you too that this will move out of the way. The part to engage the safety can move out of your way when you're trying to see the lines. Should we go into injections? Next we'll go to injection. Let's give this. So let's see, we have our patient. Now that I'm going to the room with the patient, I need my gloves on. So I did my hand hygiene, I'm wearing my gloves, you do your rights, all this would be done already ahead of time. Once I get to the patient, now we're going to scrub again. So I'm opening up my packaging. We're going to decide how big this patient is and what angle we're going to go at. So if this patient is, and I'm pinching their skin, I get an inch across here, then I'm going to go at a straight angle. If they're very thin or cachectic, we're going to just, and you have more of a small, you can't hardly pinch any fat up, and they're thin, we're going to go at a 45-degree angle. We'll do each of those. And then if they're heavier set, you're going to go straight in with the needle, and I can't pinch, it's over 2 inches. I cannot pinch up the skin. Then I'm going to go straight in, and that's in your textbook. You can find that too. So let's say our patient here is 150-pound male, and we're going to go straight in this time. So I'm cleaning off the site, circular motion, 15 seconds, going to let that dry, and then I'm taking off my cap. And I already have my things, my medicine in here, and then we're going to go at a straight angle. So I'm pinching it, and then I go straight in, and then I give the injection slowly, and then I'm going to pull it out the same direction that I just went in, and then I engage my safety, and then I put it right to the sharp box. So that's an important step. You want to make sure that you're engaging that before you start walking around or doing anything else. That needs to be done with one hand only. And I'm going to do this again. I'm going to just show you the other injections. So I'm just going to pull back 10 of air so we can show you how to do the other ones. So again, you have your cap. I already cleaned this off. If this is somebody that's really thin, this is important. You don't want to go at an angle, 45-degree angle, towards your fingers, ever. You want to go along your fingers like this. So, and again, my finger's not out here on top of this. It's down here. So in, and then you push the injection in slowly, and then you come out the same direction, and I'm still holding the pinch and letting go. The same hand, I would click this and put into the box. Click into the box. However, I'm going to show you somebody who I can't pinch more. I'm pinching over 2 inches. So again, I clean that site. Let me just pull back a little bit. And now we're going to go straight in. So it's straight in, and I've spread it taut. And then straight in like this. So I did hold that skin back like this again, and straight in. Give it slowly, pull it straight out, and then engage in the same hand that you just did it with. Do not bring this hand over to engage this. Click it, and then to the box it goes. All right, good. Let's talk about heparin here. So again, we need to get all our syringes assembled. And what I'm going to use this time, extra filter. Here it is. Okay. So we're doing this here. I'm getting my 3 milliliter syringe. I'm using my 5/8 needle, and then I'm going to select one of these, whichever available. If I have the filter needle, I'm going to choose it. So I'm going to open up my packaging and get it assembled. This stays sterile, this comes off the cap, and this stays sterile. You're connecting the two together, and I'm pulling back the amount of air I'll need. So we do your calculations, and for heparin, we decide that we're going to need a half for this. I have my bottle here ready, and I'm going to clean it off with my alcohol pad. Grab another one here. And my cups. All right, this one we're going to clean off 15 seconds. And then we're taking off our cap. Now, what do we do with this? I don't have my cup. You have 2 cups there. You can put this on the long side here on top of the alcohol pad like this, and scoop it if you need to recap this. Or you can do it on the edge of the table like this. However, a lot of times you're shaking when you're in clinical, and it's hard to get that in there just right. Once your bevel is covered, then you can scoop it up like this. All right, my cap's on, I got this open. So we're gonna go into, I'm gonna lay this down here on my alcohol pad for right now. I'm gonna go into my vial, bevel up, so it's gonna go in at an angle like this, and a 45-degree angle, and once it's in, I straighten it out, and then it's air to air. Then I push my needle all the way in, and I pull this back like this. And again, now you can see why it's important to see your needle, because now I have to pull this down below the fluid level. If I don't, I'm going to get all air. So pulling that down, I'm going to pull back quickly again, and then I'm going to push this back up. Now you can see I have air right here. So I put my needle back in, I hold everything secure this way, put my fingers this way, and I'll tap it, and I'll rotate it, and I'll tap it until I get that needle out. I know your fingers might be a little delicate, and this might hurt a little bit, but toughen up. There it goes. Now I got it in. I'm going to pull back just a little bit more medicine because I just placed it. So I'm down to my half now. I'm going to pull this out of my bottle. I'm going to scoop this needle without touching it, without my other hand, until it's covered. Now I can click it. Now your medicine is in here. I need to draw it back out of there. So I pull this back, and now I just pull the medicine out of the needle. I'm going to change this out. This goes in your sharp box. Okay. Then I'm going to pull out my 5/8 needle, which is good for heparin, or sub-Qs. And again, this stays sterile. And then you connect the two. Now I need to prime that needle. So I'm going to push that fluid back up in to my 1/2 mark. Now with heparin, it's a little different. We want to put a small airlock in there. So I go down to 0.2 of air. I can put back in. Make a little bit more. 0.2. When I go to give to the patient, that airlock needs to be at the top. A lot of your pre-packaged anticoagulants come this way with that airlock. Don't push it out before you give to the patient. That airlock is important to secure the medicine into the tissue, and so that it doesn't come out and cause bruising that can occur. So they always pick the abdomen for anticoagulants. It's supposed to be better absorbed there. So I found in my MAR that the last time it was given was the right lower quadrant. So maybe I want to go to the upper quadrant this time. So I'm just going to clean that area. Take off my needle. Just take it off. Don't be gentle about it either, because it'll bounce back on yourself. Take it off. You're not going to need it again. Again, this is when I'm going to pinch, and I'm going to go straight in. All right, and then we give the injection slowly, holding the pinch the whole time, pulling straight out the way it went in, and again I'm going to click that with one hand, the same hand that I just used, and put it into my sharps box. Now you may dab this area if you want, but not with the alcohol pad. You can maybe use a gauze or something else if you need to. And I think that should get you a good head start on your sub-Q injections.